Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Well, students, I think so. Hope so. You all are good, fine, and healthy. And this time, you're really going to enjoy the classes. And the most important thing is that first we are going to do the revision of all the topics, all the syllabus, and then we are going to move toward the chapter genetics. Okay. So, in pharmacology, I'm just going through you that what is a pharmacology so that we will have some test relevant to the pharmacology test by tomorrow, like according to this chapter. It's like that, students. The pharmacology is basically the branch of the biology in which we are going to study about the drug's composition. We are going to study what? About the drugs. So, the pharmacology is basically you should know the definition of the pharmacology at least. Okay, it is like that. It is a study of the drug composition, properties, and the medical application. And the most important thing is that the sources of the drugs are also studied in the pharmacology. So, pharma means beta, the medicines. The pharma means the medicines, and the logy means you know very well. The logy means to study. So, to study the medicines, it's not only the medicines composition, also its properties, as well as from where we are going to get these medicines. This all is going to done under the heading of the pharmacology. Now, there are basically before, like in the history in the before the 19th century, we were only working on the clinical pharmacology. Like early pharmacology were like, if you remember, like if you know that if you're going to observe that your grandmas or your grandmas, they're telling you the natural remedies. अगर किसी को जख्म हो गया तो कह दिया जाएगा हल्दी लगा दो, है ना? Obviously there is some chemical in the haldi which is helping in the healing, but now the modern pharmacology is the clinical pharmacology in which पहले तो कह दिया हल्दी लगा दो. अब क्लिनिकल फार्माकोलॉजी में क्या है? टू एक्सट्रैक्ट दैट स्पेसिफिक chemical which is present in the healthy and which is going to help in the healing. तो यानी कि क्लिनिकल स्टडी होगी, ये लैब्स में बनाए जा रहे हैं ड्रग्स. ठीक है. नाउ व्हाट इज द डेफिनेशन ऑफ द ड्रग? एनी सब्सटेंस व्हेन एब्जॉर्ब्ड बाय द बॉडी, ठीक है, एंड इट इज गोइंग टू अल्टर द नॉर्मल फंक्शन, दिस इज नोन एज द drug. Is it clear to you? So what is a drug, beta? The drug is basically anything which is going to absorb by the living organism. It is going to absorb by the living organism, and it's going to change. It is going to do what? It is going to change the function of the body, a normal function of the body. This is known as a drug. Clear? What is a drug? The drug is basically a chemical or any substance that is going to absorb in the living organism, and it is going to alter the function, a normal function. So this is known as a drug. Clear? So beta, the drugs basically, there are, you can say the drugs are broadly classified into two types. The one is the pharmaceutical drug. The pharmaceutical drug is also known as a medicinal drug, and it is defined as a chemical which is used to cure you, which is going to cure, which is going to treat, or which is going to prevent any disease. It is a beneficial for you. These kind of the drugs are basically helping in the cure, helping in the treatment, helping in the prevention of the any kind of disease. Let's suppose you have a headache, you are taking the Panadol. So what is that Panadol? That is a medicinal drug which is actually helping to relieve you from the headache. Clear? But what other drug is the addictive drug, and this drug is basically cause addiction. Addiction means that a person is going to start depending upon this medicine. Let's suppose nicotine. The nicotine used to activate the brain cells, like you become overactive. Okay? Now what is happening there? When you start taking this type of the drug, you are going to become addictive of this drug, and without this drug you are not going to think properly. So this is known as the addictive drug. Clear? So what we are going to do in this chapter, we are going to learn about the pharmacology, the sources of the pharmacology. Clear? So it is like that, students. Let's see the next topic, and that is the medicinal drugs. Basically, the medicinal drugs. What are the medicinal drugs? I have told you before. The medicinal drugs are those drugs which are going to be like, which is going to use for the cure, for the treatment, okay, or for preventing the disease. So the first thing is that synthetic drugs. If we are going to see the sources of the medicinal drug, then the first thing is a synthetic, like you used to synthesize it. What? We used to synthesize these kind of the drugs in the laboratory. Like I've told you before, the Panadol. Hmm? This is a kind of the drug which we use to synthesize in the lab. And similarly, there are the example which is given here is the aspirin. Aspirin, I think so. You know it very well about Disprin. The Disprin is actually helping in the control of the blood pressure, as well as it is also helping in the pan. So these kind of the drugs we are not able to extract from the nature. Okay, this is not present in the nature. We need to synthesize such kind of the drug, and this is known as a synthetic drug. This is known as what? Synthetic drug. So I hope so you get it. The other drug is the source of the drug is the plant and the fungi. We are also extracting the drug from the plant and the fungi. Let's see. From the bitter, basically, there are many chemicals present in the plant and the fungi, and we can use these chemicals for healing, for preventing the disease, for the curing of the disease. So, what is like that? It is like that, students. Okay, the medicines which are obtained from the plant and the fungi are millions in the numbers, because obviously we are like haldi have the chemical haldi, huh? Turmeric powder that is present in your home and it is helping in the healing. कहीं पे भी दर्द होगा आपको कहा जाएगा कि हल्दी हल्दी लगा दो, ऐसा होता है ना. इससे द लौंग लौंग जो होती है, you used to say that that is called coil, that you are using for your teeth pan. ठीक है. So similarly beta, there are the like antibiotic or the cardiotonics or some that is what analgesic. These analgesic, antibiotic, and the cardiotonics we are getting from the plant of the fungi. Antibiotics that is working against the bacteria is known as the antibiotic. Cardiotonics that is working on the cardiac. Cardiac means heart, so it is working on the cardiac heartbeat. Okay. Similarly, there are one other like that is what is that? Analgesic. What is that beta analgesic? What do you know that? So the analgesic is basically the pain relief, painkiller. So the antibiotic which we are getting is from the fungi, and the name of this fungi is basically the it is not mentioned here that, but the antibiotic which we are going to get from the fungi is the penicillin, and this is the first ever antibiotic, okay, which is was discovered. So it is like that beta ki the penicillin is basically the antibiotic which used to kill the bacteria and we used to obtain from the fungus. Similarly, the cardiotonics also known as the cardiotonic, the drug of the cardiotonic known as name is a digitalis. Okay, it used to stimulate the heartbeat, and we used to get this drug from the purple flower name is a foxglove. So it is like that beta, we are getting the cardiotonics. The cardiotonics are those drugs which are actually causing to stimulate the heartbeat. It is actually stimulating the heartbeat, and the most common cardiotonics which we are getting from the plant is known as a digitalis. What is that? Digitalis. And digitalis we used to obtain from the flower. The purple flower name is the foxglove. Okay, the analgesic is the pain relief and the which used to reduce the pain, and the most perfect medicine that is actually helping in reducing the pain is the morphine. Might you have heard this word before, because it is also a drug addiction, like it also result in the drug like addiction, but it is also helping to reveal the pain, and that is known as the morphine. And we used to get it from the opium, and it is, you can say that, which come from the juice of the opium poppy plant. So might you have seen such kind of the plant before, अगर आप लोगों ने ऐसा plant देखा हुआ है अपनी life में. Let me to see, opium आपकी book में draw हुआ है somewhere. Let me to tell you, if we are going to see that plant, no, it is not drawn here. Well, basically it's students. So student, it is like that. This is the opium. Might you have seen that all around in the weeds of your, in the weed of the barren area, that is the grown present around somewhere near to your home. This is very common. So you can see that this juice is basically the poppy juice, and this used to provide the morphine, and the morphine is one of the very good, you can say that, the drug which is used to reveal the pain. Mostly you have seen the surgery when we are doing the surgeries, and it is quite panic, so we are giving the patient the morphine to remove or to reduce that pain. Similarly, we are also able to get the drugs from the animals, and from which part of the animal? The granular product. Like we are also getting the drug from the animals, the glandular product, like fish olive oil. Have you ever seen any medicine which is containing the fish liver oil? It is basically very good for the vitamin D. Similarly, mask, beeswax, we know it very well. We are using it in the medicines. Similarly, many of the hormones of the animals and many of the antitoxins, these kind of the things we use to obtain from the animal source. So which kind of the things we are getting from the animal source? The first thing is that we are getting the hormones like if you remember the insulin, glucagon, these kind of the hormones we used to get from the animals. Similarly, we are also getting the antitoxin. Antitoxin, what is that antitoxin? The anti means against the toxin. Toxin means poison. So anything which is working against the poison is known as the antitoxin, and we used to get this antitoxin also from the animals. Similarly, there are some very common oils like liver oil, which is very good in the, you can say that in the vitamin D. Similarly, beeswax, musk, and the granular products we are getting from the animals. So it is also a very good product. So what is the okay, the next one is the drugs from the minerals. We are also getting the drugs from the minerals. Like, let's give you one a very good example. Do you remember that what is the iodine? That iodine is a mineral, and you have learned in the chapter number 3 about the disease like those which are having the lack of the thyroxine that results in the goiter, and obviously this is due to the lack of the iodine. So we're getting the iodine from this mineral to maintain or to cover that disease or to activate the working of the thyroid gland. Similarly, beta, if you have ever seen the drug name is a pyridine, which you are putting on your wounds whenever you used to get the injured, that is a brownish in color, bromine. So obviously there is a bromine, a mineral which is actually present in that chemical pyridine. It is helping to heal the wound. And might better you have seen a powder whenever you're like a powder which used to heal, or you can say which used to remove the bacteria from the wound, that the powder known as कि जख्मों वाला powder है. Whenever you are going to get the injured कहा जाता है कि जख्मों वाला powder डाल दो. So what is this? This is basically a powder that contains the silver nitrate, and it is also helping to apply it on the wound to stop the bleeding or to prevent the infection. So you have come to know about the iodines, and there is a bromine also, as I told you before, that is used in the pyridine. Might you have learned that kind of the chemicals. So this is also very much important. Similarly, we are also able to get the products from the bacteria, and bacteria, yes, we are getting the antibacteria from the bacteria. Means we are getting such kind of the products from the bacteria which can kill bacteria, like streptomycin. This is a very good drug, antibiotic, which is actually killing the bacteria, and this is known as the antibacterial drugs or streptomycin. And there are many other drugs like tetracycline, cephalosporin, which you have already learned before. So these are basically the drugs which you are going to get from the bacteria. Now student, what is your task? Your task is that, okay, the assignment which you are going to give me, that write down the questions. Write here the question that define pharmacology, and which type of the pharmacology was present in the Middle Ages. ठीक है, define drug, define the types of the drugs. These are the questions which you have to done. Okay, then there is better write a note on the medicinal drugs. So obviously when you are going to write the note, you are going to write in detail about synthetic drugs from plant and the fungi, drugs from the animals, drugs from the bacteria, drugs from the minerals. So you are going to discuss this thing in the detail. Clear? I hope so you get it. And if you're relevant to that. Okay students, now how you are going to do that assignment? Obviously, as I told you in the class, you are going to first learn these all questions answers, and then you are going to do the practice. Means सिर्फ याद नहीं करना, साथ अपनी ज़ुबानी लिखना भी है, which I am going to see in the class. मैं आपकी ये assignments class में देखूंगी. So you have to do your work a very neat on your biology neat copy. अगर copy ख़त्म हो गई है तो नहीं बना लो. And I want a very neat work, and it is like that students कि you have to now give your 100%. attendance. Plus you have to give your 100% efforts as well, because when I'm giving my 100%, then obviously in return I would love to take 100%. Clear? In fact I have revised the lecture, मैंने lecture रिवाइज भी कर दिया. नेक्स्ट टाइम हम ऐसा करेंगे, वो वाला लेक्चर सिर्फ रिवाइज करेंगे जो आपको समझ ना आया हो. ठीक है? सो बेटा वर्क हार्ड, स्टे ब्लेस्ड एंड अल्लाह हाफिज़.